VYZULTA, latanoprostene bunod ophthalmic solution, 0.024% is indicated for the reduction of intraocular pressure, IOP, in patients with open-angle glaucoma or ocular hypertension. Please see important safety information at the end of this video.
So one of the better aspects of VYZULTA is commercial insurance acceptance. You often don't need to go through prior authorization with commercial insurance. However, for your patients who are on Medicare, you often have to go through a prior authorization. I have great staff who know that process inside and out, and it comes down to compliance for the patient and clinical effectiveness. If you feel monotherapy is best for your patient to ensure compliance, one drop is the way you should go.
For my Medicare patients, it's a little trickier just because we know that we're going to probably experience a prior authorization request, and our staff knows that when I prescribe it to a Medicare eligible patient that we're going to have a little bit of work to do. And we have somewhat of a protocol of the things that we'd like to see in those prior authorizations to make the case for why we need VYZULTA.
What I will tell you is this: have I had to do prior auths for VYZULTA? Absolutely. Since its inception, since its approval, the process has become much easier, much more seamless, and we're getting pretty much across the board approvals for prior auths in the right patient demographic.
Important safety information. Increased pigmentation of the iris and periorbital tissue, eyelid, can occur. Iris pigmentation is likely to be permanent. Gradual changes to eyelashes, including increased length, increased thickness, and number of eyelashes, may occur. These changes are usually reversible upon treatment discontinuation. Use with caution in patients with a history of intraocular inflammation, iritis, uveitis. VYZULTA should generally not be used in patients with active intraocular inflammation. Macular edema, including cystoid macular edema, has been reported during treatment with prostaglandin analogs. Use with caution in aphakic patients, in pseudophakic patients with a torn posterior lens capsule, or in patients with known risk factors for macular edema. There have been reports of bacterial keratitis associated with the number of multiple dose containers of topical ophthalmic products that were inadvertently contaminated by patients. Contact lenses should be removed prior to the administration of VYZULTA and may be reinserted 15 minutes after administration. Most common ocular adverse reactions with incidence of greater than or equal to 2% are conjunctival hyperemia, 6%, eye irritation, 4%, eye pain, 3%, and installation site pain, 2%. Please see full prescribing information at VYZULTA.com.